Hello everyone. Today's video is another Q&A video talking today about using low-dose immunotherapy for mold and mycotoxins. What else here? Talking about possible reaction to ozone therapy, and then I'm going to share a little clinic anecdote about a seeming reaction to methylene blue, which first time I've seen this happen in someone, so I thought I would share this in a video as well. As per usual, nothing that I'm saying should be construed as medical advice. It's for informational purposes only. If you need medical advice, please ask your healthcare provider to get that advice. And if you wouldn't mind taking a quick moment at some point to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. So the first question here is, it says, can you speak to your experience using LDI, low-dose immunotherapy, for inappropriate immune response to mold/mycotoxins? Thank you for all the content. So you're welcome. Thanks for partaking in my content. So with LDI for mold and mycotoxins, there is a mycotoxin mix, and so meaning a wide array of different mycotoxins in that formula. And then there's also a mold formula. The mold formula has a whole ton of different mold species in there, pretty much any mold species you can think of, ones that are known to be toxic, ones that are not known to be, or known to be non-toxic but can trigger allergies in folks. And then that mold mix is actually a subcomponent of the overarching environmental mix, or what was once what is referred to in LDA, low-dose allergen therapy, is the IC mix, for anyone who happens to know about sort of the LDA version of that. So when it comes to using those formulas, to be perfectly frank, I really haven't used the mycotoxin mix for the LDI mycotoxin mix in clinical practice, and that's largely because Dr. Vincent, who is the father of low-dose immunotherapy, the creator of low-dose immunotherapy. He does wonderful continuing education events every year, and he talks about his ongoing up-to-date experience using LDI with many people worldwide. And my understanding of what he has taught in his ongoing CE courses, including the one that I participated in just like a month ago, hot off the press, my understanding is that he has not yet seen any therapeutic response from the LDI mycotoxin mix. And if Dr. Vincent hasn't seen any change with it, and he's used it in quite a few folks to my understanding, I'm not particularly keen to ask my patients to try it, because if it doesn't seem like it's going to work, I don't really want to waste their time and efforts taking something that's probably not going to work. I'm not saying that I wouldn't try it in someone if they really wanted to, but there are a number of LDI formulas that have not stood the test of time. Classic example would be the Epstein-Barr virus formula. So many people with Epstein-Barr virus come up, reactivity, chronic EBV comes up when we test them, and yet, to my understanding, no one in the world so far has had a therapeutic response to the Epstein-Barr virus LDI formula. Same is true of cytomegalovirus formula. Same is true of a lot of the different viral formulas. There's quite a few LDI formulas that have been developed, and they just have not been shown to work in anybody so far. And the mycotoxin mix appears to be on that list. So because of the fact that there are these, say, viral formulas that have been around for a long time, way longer than the mycotoxin formula. I think that one's maybe only 3 years old or something like that. The writing on the wall seems to be it's probably not going to work. Now, there are many LDI formulas that do work consistently well, which is why we use LDI, but the mycotoxin formula does not seem to be on that list, unfortunately. So I haven't taken a dive into it because I think the writing on the wall is that it's not going to work, but it does exist, and it could be tried. And if someone has used the mycotoxin formula and it was the cat's meow, please post in the comment section below. I'd love to hear about that, but to date, it does not seem to be a successful formula. Now, the mold formula, on the other hand, which contains the actual mold spores themselves, like the mold species themselves, not their toxic byproducts, those, on the other hand, can be really helpful, but in my experience, they seem to primarily be helpful for folks who are dealing with a mold allergy. So if someone has just run-of-the-mill allergies, runny nose, watery eyes, that type of thing, chronic sinus issues, whatever classic allergy symptoms, the mold LDI mix, if they're allergic to mold, the mold LDI mix can be really helpful. So I've seen that benefit patients many times. Also, some folks who are dealing with mold illness / mold toxicity can also have a coexisting mold allergy. And so sometimes I've had patients where they are dealing with mold toxicity, but they also have symptoms that seem to be consistent with a mold allergy, put them on the mold LDI, and then some of their mold toxicity symptoms appear to improve. Appear to / do improve. And I believe that is because by treating the mold allergy, we're reducing the histamine levels in the body, and then that in turn is going to help reduce some of the symptoms / pathophysiology of the mold mycotoxins themselves, because mycotoxins are really good at jacking up histamine. So if you have mycotoxins, that's going to cause mast cell activation, leading to more histamine. If you have a mold allergy, that's going to cause more histamine release. So both of those things cause more histamine, much to the detriment of the person's body that's happening in. So by reducing the overall histamine activity in the body with the mold LDI, it can be helpful for patients dealing with mold toxicity. So long-winded way of saying that mycotoxin mix does not seem to work. Mold LDI can be very helpful, definitely in mold allergy, or oftentimes in mold allergy, but can also be helpful in mold toxicity in kind of more of a roundabout way. Any follow-up questions on that, just post in the comment section below. I can clearly talk about this all day, so if anybody wants to get into the weeds, I'm more than happy to post another video about this. The next question here, so it says, my mother had has had a cough since a few days ago, and then she started ozone therapy for knee pain, and the coughing is persistent ever since then. She did take medication for the cough, but it didn't resolve. Could it be a side effect of the ozone therapy? She's already taken 3 sessions. Should we stop the treatment? So we have done, I've personally done like tens of thousands of ozone injections for various like orthopedic concerns, knee pain, shoulder pain, ankle pain, back pain, neck pain, name a body part, I've probably injected it. And then we've also, at my clinic, we've done, I would say, around 10,000-ish or so IV ozone treatments. I used to do them all myself, and then got too busy and then hired other colleagues to do them for me. We still do lots of them here, and I refer for them on a regular basis. So I've never seen, and the way we do that is called major autohemotherapy, or MAH. So that's kind of a specific way of doing IV ozone therapy. So with those treatments, I've never seen them induce a cough or exacerbate an existing cough. There is another form of IV ozone therapy called direct IV ozone, where you're actually injecting the ozone gas directly into the bloodstream. It is a method that has been used for many years, and some proponents of it say it works better than the major autohemotherapy method. Some folks say that it's a more dangerous method, and I won't post a video on that unless somebody asks for it, because it's getting into the nerdy weeds of IV ozone and controversies around that and whatnot. But the long and short of it is that can absolutely induce a cough. And so depending on the way that the ozone was administered, because it doesn't specify here, just as ozone therapy for knee pain, so I would assume it's an injection into the knee, but then sometimes we do use IV ozone for more systemic anti-inflammatory effects and anti-pain effects. But assuming that it was an injection into a knee, I've never ever seen that contribute to a cough. There's really no mechanism of action by which that should be able to happen, to my knowledge. But direct IV ozone could exacerbate a cough, but really only like acutely. That should wear off within like a couple of hours. So I've not seen ozone therapy in any way, shape, or form contribute to a persisting cough. So I'll leave it there. Any follow-up questions, just post in the comment section below. And then the last thing I wanted to mention here just quickly is that I had a patient who went on methylene blue, started at a low dose, gradually built up. The patient seemed to be tolerating it quite well. Like there weren't any obvious side effects as they built up to their higher and higher dose, but eventually the patient started noticing that they were waking up feeling anxious, and that was outside of the norm for them. And they were feeling anxious for a few days, and then they thought like, maybe like life's just busy or whatever, but like, no, this is weird, this is kind of standing, this is standing out. And so they thought, well, what have I done that's new? And it was methylene blue. So they stopped the methylene blue, and within a day or so, the anxiety was completely gone. So they have not restarted the methylene blue. So there wasn't that like, sort of double crossover type trial with that. But it seemed pretty compelling that the methylene blue was causing anxiety. Methylene blue is known to have that mild inhibition effect of monoamine oxidase. And so that could lead to a buildup of dopamine and or serotonin or norepinephrine in the body. and then that's something that could potentially exacerbate anxiety. So just wanted to mention that because I post a lot about methylene blue, and just something to be on the lookout for. So I'll be on the lookout for it more now in my patients too, but first time I've ever seen that. Anyways, I'll leave it there for now. Hope this was of interest. Any comments or questions, just post in the comment section below.